Good afternoon. It is April 15th, 2020. My name is Virginia Thralkeld Larson. I'm the administrator at Keokuk County Public Health, and joining me is Dr. Lindsay Van Dyne, who is our Keokuk County Board of Health physician. Lindsay, how are you doing today?
I'm doing good. Thank you for having me, Virginia.
Yeah. We'll start by a few questions. So, one of the questions we get asked at Public Health is, what does direct contact mean?
Correct. So I think what we're talking about here is how is COVID-19 or the SARS virus transmitted? And one thing we need to remember is that it's primarily spread through respiratory droplets. So this is when somebody is sneezing or coughing or rubbing their eyes. They're getting those respiratory droplets on their hand. And at that point, whatever they touch, they're spreading the virus. So if I touch this armrest or if I touch a door handle and then somebody comes behind me, they're making direct contact with my respiratory droplets that I kindly left there for them. When they touch that door handle, they now have it on their hand. And what they do with that determines where the virus goes next. If they itch their eyes or eat some food, they have directly infected themselves with the virus. So that's why we are talking about the mitigation techniques to decrease the spread of the virus, which includes washing your hands. So certainly using a alcohol that has greater than 60% concentration. We're talking about the hand sanitizers there. And then when you wash your hands, you should always be doing that for at least 20 seconds. Using soap and water, 20 seconds is the key. The reason for that is because you can actually break down the virus when you're washing your hand and properly get rid of the virus. At that point, you're safe and you can eat. A couple other mitigation techniques that they're discussing is just don't touch your face. That's really important. You could have the virus on your hand at any point, but that doesn't mean you're going to get infected. The virus will not go through healthy skin tissue. A couple other of the mitigation techniques that are really important, and we'll talk about this again later, is just wearing your mask in public. This has been supported by the CDC as well as Dr. Reynolds. And then, of course, keeping your social distancing at least 6 feet apart. And social distancing will be a new term that we will use for years to come. And that 6 feet is the magic number. So hopefully that answers your question on direct contact.
Yeah, for the COVID virus. And we've had lots of people call Keokuk County Public Health and ask what happens if they go to the doctor and the doctor says they have a upper respiratory infection. How are they supposed to return to work, or are they supposed to stay home if they're diagnosed with that upper respiratory infection?
Very good question. So a couple key things there. If you are feeling sick, the number one thing you can do is call your doctor's office. We will give you direct guidance from there. It is not a decision you need to make on your own. You can actually call us and we will help you. We have a whole triage system set up, and a doctor's office is set up to be there for you in this situation because it's very different than normal. Second thing is, if you do have sick symptoms, and that can be something as simple as a runny nose, it could be something, a dry cough, a fever, muscle aches, nausea, vomiting, diarrhea, any one of those symptoms, you really should be staying at home. And COVID can present in a variety of different ways. It can be very mild, it can be very severe. So if you have the symptoms, no, you should not be going to work. The second thing is, when can you go back to work? And we do get that question a lot. The CDC and the Iowa Department of Public Health have put out a couple of guidelines for us. The guidelines are very clear. Number one, you've had no fever for at least 72 hours, and that means you have not used Tylenol or ibuprofen to bring that fever down. So you have to be fever-free for 72 hours. Number two, your symptoms have improved. They don't need to be completely gone, but they do need to have improvement. And number three, it needs to be at least 7 days since the onset of your symptoms. We do feel that you are more prone to spread the virus when you're acutely ill, which means you're actively coughing, blowing your nose, not feeling good. I mean, you're just spreading your germs. And so after 7 days, generally you're feeling better, you're able to contain your germs. But if you do have COVID, you are still able to transmit the disease past the 7 days. So the idea is that you will no longer spread your germs and you will contain them. And we'll talk about the face mask and the hand washing, which will help with that too. So.
Okay, that's great information for us. I think everybody can learn some things that can help them stay safe, not only in their home, their community, but also with their direct family members.
Yes.
Do we have tests available in Keokuk County or?
Yes, we do.
Okay.
That's a great question. So this is a topic of discussion as well as debate amongst us healthcare workers, and it's currently our testing kits are available through the Iowa Hygienic Lab, and this goes through the state. It is located at the University of Iowa. Because we use the Iowa Hygienic Lab at Keokuk County Health Center as well as Keokuk County Medical Clinic, we have strict criteria that we have to stick to. If you want to know whether or not you have the criteria to be tested, again, just call the clinic, go to the ER, or you'll have a doctor appointment. We'll be able to tell you if you meet criteria. But the question is whether or not you should be tested even if you don't meet criteria. And we would like to say yes, but right now we cannot because we have to limit the testing based upon where the need is. Eventually we will get there. Keokuk County Health Center has made huge strides to do in-house testing, and we are getting there. We're just not there yet. Hopefully we will have that available sooner than later. And I think that answers your question. Yeah?
Yes, okay. Yes. Another question is about the mitigation techniques. Do you feel like they're effective?
Yes.
Okay.
Yes.
And can you go into more detail?
Yes. So it's such a big topic, but with the topic of pandemic, you have loose guidelines and then you have strict guidelines. And Governor Reynolds, Dr. Fauci, I could be saying his name wrong, and I certainly don't want to disrespect him. I think very highly of him. But they have made very clear guidelines from the state level up to the national level. And in there, they strongly recommend what could be equivalent to a shelter in place, which is just staying at home unless you need to get out. If you're an essential worker, of course, you need to go to work, but you don't need to be going out and about. You need to go to work and go home. It's okay to go to the grocery store, but when you go to the grocery store, you should still be following these mitigation techniques, and they are effective. Respiratory droplets don't tend to go more than 6 feet, so if you stay 6 feet from somebody, that is considered a safe distance. As far as washing your hands, there's just no better way to practice good hygiene than to wash your hands. And of course, even though you're washing your hands, try to avoid touching your face, and that's just simply because that is the very way that you get that virus into your body. So you should always be washing your hands before you eat. It's something you learned when you were young and you probably just don't always do, but now you should. As far as wearing a mask, this has been debatable, but the truth is the CDC now strongly recommends wearing a mask in public, and Dr. Reynolds also supports that, or not Dr. Reynolds, Governor Reynolds also supports this, and it is appropriate to wear a mask. Not only does it help you not touch your face, but respiratory droplets are protected from your face, and you will not be spreading respiratory droplets to others. A lot of us could be asymptomatic carriers, or perhaps we are pre-symptomatic, which means we have the virus, we just haven't developed the symptoms yet. And in that situation, we can still spread the virus. So if we're not spitting on people and not getting too close to people, that is a very effective way to keep the virus contained. I do want to give you a couple things. If you do not have a mask and you are interested in one, we have the local community pulling together and making these masks. They have donated them to Public Health, and you can always reach out to Virginia. Her phone number at Public Health is 641-622-3575, and she can help you get a mask. I know that they're going to be making efforts to spread these around the community as well. If you want to make masks or you want to join in the efforts to see what the community needs, you can always reach out to Virginia, and she can provide with those answers too. A couple key sources. We have to wrap up here due to time, but I just want to give you a couple websites that are great. I go to these websites, and there's just so much great information. The Iowa Department of Public Health has put out a new aspect on their page, and it's excellent. It's got graphs, it's got numbers, it's got updates. It discusses the entire state, breaks it down by county, and you can follow that on a daily basis. The CDC has so much good information, and then WHO, which is the World Health Organization, their website's also excellent. A phone number that you can call for further information is 211. Instead of 911, you would dial 211. Somebody will be on the other side of that line, and they'll be able to answer questions that you have specifically regarding the coronavirus and the COVID-19 infection. I think that's it.
Okay.
Yeah.
Do you think we can provide the community with some weekly updates or bi-weekly updates?
Yes, so I did fail to mention this, and this is so important. Iowa's peak is projected to hit April 26th. We cannot let down our guards. We need to practice these mitigation techniques. We need to take them seriously. We have been blessed here in Keokuk County with only having 2 cases, and both of those folks have healed well, and we likely have the disease. We are just not testing everybody, so we can't say that we are exempt from this illness, and we could still see them coming in. We can also still see a peak here in Keokuk County, so mitigation techniques are so important. Again, the peak is anticipated to be April 26th, and then we should start seeing a downslope after that. The state has also announced that we have plenty of beds for people. We also have plenty of vents, and that's excellent news. Happy tears in that one. I'm happy to give weekly updates, and of course, if you guys have questions, you can always submit those to Virginia or myself. You can post in the links below, and we'll try to answer those in the upcoming week.
Wonderful. Thank you very much, Lindsay. It's been a pleasure. And any questions, you can talk to your primary care, call the clinic, and if you have severe shortness of breath, please go to your local ER. If it's so severe, you can also dial 911 for immediate help. And I think that's all for today.
All right.
Thanks
Thanks
you.
for having me, Virginia.
Yep, thank you.